Brian Moore is co-owner of the Clayton Ranch Market. That's a grocery store in the northeastern part of the state. And Christina Campos is the administrator of the Guadalupe County Hospital. That's in Santa Rosa. Thanks both for making time. We appreciate it.
Thank you.
Thanks, Matt, for having us.
Absolutely. So the first Saturday of Phase 1A opening, that's the very beginning of the rollout that you all have been keeping an eye on. We saw a lot of retailers, at least in Albuquerque and some of the metro areas, decide to stay closed. What's behind that for some of them, do you think?
Well, I think, I'll go first quick. I think it's a fear. I think, I kind of envision this like people coming out from a Holocaust and the sun is shining, and they're peering out, but they're afraid to venture forward. Uncertainty about how to behave in this new world. I think that's a lot of it, and making sure that they're keeping their customers and their employees safe.
And Brian, how about you?
Well said, Christina. I think some of that's for sure. There's still some challenges, I think, with small companies trying to find the right PPE for their employees, particularly. I know a few little businesses in Clayton. I kind of had stored some masks and gloves and sanitizer for them, and they all got opened up. But there's a little bit of fear factor in there.
I'm sure. Brian, you're probably a good person to go to for this. As we look at retailers opening and the things that we're calling COVID safe practices, are you finding that for some retailers, it's just difficult to get the things that they need to stay open?
It's better now than it was.
Okay.
We have a grocery store, and so we've been in probably better shape than most. But boy, for the first 4 or 5 weeks, it was just heck getting masks and sanitizer and all those things. And as it's progressed along, we're much better off. And we try to keep a pretty good supply on hand, not only for our guys, but for other people, other businesses that need some help.
Sure. You're both from rural areas, Christina.
Yes.
Most of the media coverage that we see, of course, is centered on Albuquerque and sometimes Las Cruces, Rio Rancho, Santa Fe, that sort of thing. What have you seen and heard in your part of the state?
Well, we've had a couple of flare-ups here in our community. So, recently they listed the top 6 counties with, the worst numbers per 100,000, and we fell into that. Guadalupe County did. We have 19 positives, or at the most recent numbers were 19. So for a population as small as ours, that's a lot. But those flare-ups also created a certain level of awareness and a desire for people to be a lot more careful in the community and safer. So you see the adoption of these CSPs occurring naturally even before a lot of the direction was published.
Have you all, or I guess you'd probably get reports through the other places in the administration, have you heard from businesses that have questions about, okay, so what is a COVID safe practice for someone in my sector?
Yeah, I think we've all got questions about those. And the council spent a week and a half going through all of those. And a lot of the work had been done before we ever got a chance to see them. So there's a lot of work going on, but at least the industry insiders worked with the cabinet secretaries to kind of work through those requirements. And I don't think they're horrible. The ones I've looked at have not been too bad, at least for our industry in specific. But the governor's office has published a CSP guideline book. It's on her website, and it's really a nice presentation. And you can just go through industry by industry, and it's pretty easy to do. But I don't know that the word has gotten out there quite as well. I'm still getting calls from hotels, for example, and restaurants, for example, about what happens next. So it's out there, but we need to publish it more.
Yeah, I think a lot of what we see also is businesses that have developed their own, and they want assurances that they are well developed, that they do make sense, and that they're in compliance with what the state is thinking. So in a sense, the ERC, the council, didn't just develop policies. In many ways, we adopted recommendations that were already out there, industry by industry.
Okay. As we look at businesses, in some ways, it seems like they can lead us out into the normalization of some of the things like wearing masks in public, continued safe social distancing. I picked up some hand sanitizer at a hardware store, a small hardware store the other day, and the owner was reminding customers, hey, we're not out of this. There are actually more people out and about. Keep being safe. I would imagine that's exactly the kind of thing you want to see from businesses. But is there something to that idea that they can help us with the normalization of wearing a face covering or something like that?
Yeah, I agree. I agree that both businesses and community leaders, I think there's been a concerted effort to get, those people that others look up to start adopting these practices and to help us normalize them.
And Brian,
I think
how
that's
about
right.
you? Are people anxious to hear that message from the business community as opposed to the government?
I think it's more helpful. The government is a big kind of massive force, I guess I should say. And if they see me or the mayor or the county commissioners wearing masks, I think it helps to make it more normal.
Sure. This is going to be a different summer than I think any of us have ever had before. What are some of the changes that we're going to see? My mind first goes to the festivals, fairs, things
Mhm.
like that. But from your perspective, what are some of the big changes we'll be seeing?
I think a lot of it will be smaller groups. My community is popular for Blue Hole and for the Whibbit now for the water park. And there'll be efforts to get Blue Hole up and running for the scuba divers, but probably on an appointment only basis. The Whibbit, I just don't foresee how they'll be able to get it going because it's primarily children and they're, fooling around in the water and splashing and shoving. And I just don't see how you can do that in a safe manner. You're not going to wear a mask in the water. So I think this summer definitely will not look like last summer, but we do have the challenge of trying to make it as enjoyable as possible.
It's a good point, Christina. In our community, we have a Fourth of July rodeo that we've done for 60 years, and so we're going through the process of canceling it, and it's really hard. A lot of people are pretty devoted to being in Clayton for the parade, the rodeo, and the street dance, and all those things. So it'll be much different from that perspective. But I do hope that some of the mass gathering numbers will be relaxed a little bit, so at least larger families can get together and go to the lake or play golf and do those kinds of outdoor recreation things.
As the ERC or the Economic Recovery Council meets and discusses the various phases of reopening, is this the sort of discussion that's happening? How do we get to this point? Tell me how that works.
It's a really really great committee. The membership is really representative of our state, of industries, of political affiliations and perspectives. So there's a lot of push and pull. There's a lot of discussion. I own two restaurants, and so one's closed, one's open. I have that perspective. I've got the hospital perspective. So even within myself, I'm kind of like a small a microcosm of the community itself. That part of me really wants to move fast and open, but I'm kind of a little afraid to. And then the healthcare part of me is really concerned with inundating my staff and stretching them in a manner that makes it less safe for them, and in a sense even for the patients. If you've got too many people here at the same time, you're not giving them that personalized care that you're used to giving them. So we've got that push and pull going on, but it's I've really enjoyed the dynamic within it, but these conversations are so common to every single opportunity that we have to meet.
I think it's a great council too, Matt and Christina. And Christina does bring us the two sides of it together. Some of us are business guys like me, and we're ready to move on. And Christina can kind of help us understand the other side of that piece, which is really helpful. But it's a good council in terms of, we've got business guys, we've got Peter Trevisani that owns the New Mexico United. So we got a lot of variety of people on it, and they're not shy. They will tell you what they're thinking and what they're hearing, and so we have some pretty good discussions. But it's a respectful civil group.
Yeah. I think everybody has the same goal of balancing the health of our economy with the health of our people.
Sure. I remember the governor, when she formed the council, used the words smart and patient. And I'm sure that there's a balance to strike. How does that work? Do you have a number of meetings yet coming up? And will you be looking at data coming in from public health experts, from, in terms maybe tax and rev, in terms of what you're seeing for gross receipts tax, that sort of thing? Will you be meeting throughout the summer?
I'll be meeting for, yeah, go ahead, Christina.
No, go ahead. But I believe so, right, Brian?
I think we'll be meeting through the summer, at least for the next couple of months anyway, as we look at as we start to reopen, what happens with both the health perspectives and, how's the economy doing. You mentioned it, Matt, some of the businesses haven't opened it yet. And even when they do open, they're not going to probably have as many customers as they did before. So how does that affect all of that going forward? We're looking at, we've got some subcommittees set up this week that we're going to start looking at possible legislation and things that we can help move things along.
Yeah, and we've met, depending on the workload, we've met as much as 4 times in a week and as little as twice in a week. I think we are developing, the committee seems to be as fluid as the situation, that first we really wanted to focus on ways to make businesses safer so that they could open as safely and as soon as possible. And now we're starting to look kind of beyond, that closed horizon at economic relief, at the long-term economic development of our state. What are we going to look like? And do we have the infrastructure in place to help get to that future? For example, broadband. So, there's a lot, I think the governor would like to continue having this council meet, but start looking at the entire situation from a broader and different perspectives.
That's a fascinating idea. The idea that we might get things like broadband security or growth
Right.
coming out of this. And as Brian mentioned, looking at the legislative session on June 18th to perhaps provide a framework for some of that. Well, the few minutes that we have evaporated pretty quickly, but I really thank you both for your time and, of course, for your work on this. I think it's helpful for a lot of people to hear your perspective.
Thanks, Matt. Appreciate you.
Stay safe.